Hi there, welcome to this channel. We'll talk about the latest updates in the COVID-19 pandemic. As of today, January 19th, 2021, globally there have been over 96 million confirmed cases and over 2 million deaths. In the United States today, we are over 24 million cases, and today was a milestone of breaking 400,000 US deaths. Recently, there have been some ups and downs in terms of new cases in the United States, peaking in just a few days ago at 250,000 average new cases per day. Today, we're down to 207,900 new cases a day. So hopefully this trend continues to go down. And in terms of deaths, there has also been a few ups and downs, but we are pretty close to the top here at over 3,000 new deaths per day, and most recently around 3,200 new deaths per day. And if you look at the curve for total deaths over time, hoping there's an inflection and maybe this will start to plateau, but there has been a recent run-up of deaths in the last month to month and a half over the winter holidays. The good news is there are 2 vaccines currently available in the United States to help combat COVID-19. The 2 that are available are the Pfizer-BioNTech vaccine and the Moderna vaccine. Both of these are mRNA vaccines. Now, how does mRNA vaccines work? Basically, the mRNA vaccine is a short piece of mRNA or genetic material that codes for a protein, in this case the spike protein, on the coronavirus. And what that does, it trains the body to recognize that spike protein piece and produce antibodies against it. So since the mRNA only codes for that spike protein, it does not include the genetic material that causes disease and replication of virus. So there is no chance of a viral infection due to the vaccine. Now, the mRNA vaccines are intramuscular injections into the upper arm. Now, let's talk about the 2 vaccines that are available. First, there is the Pfizer-BioNTech COVID-19 vaccine, or in this case, called BNT162b2. And this is given as 2 shots 21 days apart, so 3 weeks apart. It's a shot into the muscle of the upper arm, it's an intramuscular injection. The other thing I'll mention about the Pfizer vaccine is it does need to be stored in an ultra cold freezer, and that's between -80 degrees Celsius and -60 degrees Celsius. Not many institutions have these refrigerators or freezers, so transport and storage could be an issue. However, once it's ready for vaccination, it can be stored in the refrigerator from 2 to 8 degrees Celsius for up to 5 days. The other vaccine is the Moderna vaccine, and that is called mRNA-1273, made by Moderna Therapeutics. And this is 2 shots given once a month, so 28 days apart, also into the muscle of the upper arm. In contrast, the Moderna vaccine does also need to be stored in a freezer, but this is a -25 to -15 degrees Celsius freezer, which is more commonly available. And also it can be stored in the refrigerator from 2 to 8 degrees for up to 30 days before the vials are punctured. So slightly longer shelf stability. Now both vaccines have shown a 95% efficacy through their clinical trials. So here's a paper published in the New England Journal of Medicine testing the Pfizer vaccine, which is the BNT162b2 mRNA COVID vaccine. And in a trial of 43,548 participants who were randomized to get either the injection or placebo, about half injection and half placebo, there were 8 cases of COVID at least 7 days after the second dose for those that received the vaccine, and 162 cases for those that were assigned the placebo, giving a 95% effective rate in preventing COVID-19. Now, similarly, for the Moderna vaccine, mRNA 1273 SARS-CoV-2 vaccine, also in the New England Journal of Medicine, a publication showing that of 30,420 volunteers who were randomly assigned half to placebo and half to the vaccine, they saw that in the placebo group, 185 participants was symptomatic for COVID-19, and in the vaccine group, 11 participants was shown symptomatic for COVID-19, giving an over vaccine efficacy rate of 94.1%. So overall, both vaccines are quite efficacious and relatively safe. And as of today, millions of doses have been administered across the United States. Here you can see the number of vaccines that have been administered in the United States. As of this last month, since the vaccine's been available up till today, over 12 million vaccines have been administered as of yesterday, so January 18th, 2021. So the next question is, how can I get a vaccine? Well, it really depends on where you live, what state you live in. So the allocation of vaccines across the United States is not consistent across the different states. So here's just highlighting a few states in terms of vaccines that have been allocated and normalized by population. So COVID-19 vaccines allocated per 100,000 people. So you can see, for just picking out 4 states, for example, Texas, I guess recently received another allocation. So Texas has almost 12,000 vaccines per 100,000 people. Whereas California, the most populous state, is closer to over 4,461 vaccines per 100,000 people. Florida and New York have 2,500 vaccines per 100,000 people and 2,200 vaccines for New York. So depending on your state's rollout, it may be more widely available or not. I know in the news we've heard long lines in Florida to get that vaccine. And I also know in California, it is a tiered approach. And while the state says age 65 and older are eligible to receive the vaccine, most counties do not have the capacity for that. And so far has been mainly relegated to those age 75 and over, as well as healthcare workers. And as always, if you're interested in any of the information presented in this video, I'll put links to the sources in the description down below. So hopefully that gives you a sense of where we are today in terms of the COVID-19 pandemic. the case rates, the death rates, as well as the vaccines that are currently available and the differences of availability across different states. That's it for this video. Thanks for watching. Stay safe. And remember, wash your hands, social distance, and wear a mask. We're all in this together.